Hi everyone, my name is Marie McGrogan and I am the clinical advisor for TG Eakin. So just to give you a wee bit of background about me, I started my career as a stomach care nurse in the early 1990s. So it's safe to say I've always had a passion for both caring and supporting this group of very vulnerable patients within their journey towards the physical and psychological adjustment. And I recently produced a white paper which focused on the psychological impact of stoma formation. And during the course of the research and the development of the white paper, it became quite evident that whilst there has been huge progression within the quality and efficacy of both products and services over the last 30 years, it was also abundantly clear that the psychological impact of stoma formation continues to be a considerable issue for so many of our patients. The studies consistently highlighted three main areas of concern. Firstly, the loss of control, which leads for many to almost a grieving process. And then the altered body image with reduced self-esteem, but also the importance and the value of self-efficacy for our patients. And then the fear of intimacy, which, as we know, can result in so many psychosexual issues for our patients. But I also, whilst I continue to research, I also realised the impact that enhanced recovery, what it may have now, now that it's embedded into clinical practice in so many countries. And obviously means that as stomach care nurses, you're under increasing pressure to prepare your patients earlier for discharge, and therefore have reduced time to be able to spend on delivering and supporting with that whole psychological aspect. However, in my personal opinion, and hopefully you will agree, I believe the psychological and the psychosexual rehabilitation should be considered as critical within each patient's journey, and therefore should become as integral to the recovery as, say, for example, the sighting of a patient's stoma. So with these themes in mind, as a company within Eakin, we are now embarking on a series of webinars which really complement the white paper and its findings. As stomach care nurses, we should be equipped to support each patient towards a level of acceptance and be armed with the skills to address highly sensitive issues. By raising more awareness, we hope that this series of webinars will enhance your clinical practice and ultimately make a difference to your patients within these fundamental issues. So without further ado, I would like to introduce you to today's expert speaker, Brona Stars. Brona is a psychotherapist, writer, and also teaches and presents both nationally and internationally. Brona's presentation today is entitled From Shame to Empowerment When Living with a Stoma. So on behalf of Eakin, Brona, I would like to say a massive thank you for agreeing to present and share your wealth of both knowledge and experience today. Over to you.
Hi everyone, my name is Brona Stars. I'm a psychotherapist in Northern Ireland, and I work with lots of people who've experienced trauma, different forms of trauma. I work a lot with young people, but across the age groups as well. And I wanted to talk to you today about some of the psychological aspects of living with a stoma, and this presentation is entitled From Shame to Empowerment. So I want to share my screen with you and share a PowerPoint presentation, so just bear with me for a second. Because hopefully you can see that. So in terms of defining shame, I think two elements are present for shame. One is that what is happening matters to me, and the second is that I direct blame to myself. And of course, when someone has a stoma, they feel awful a lot of the time about themselves, and they have a lot of shame around their body, and of course it matters. The impact of having it and the difference of not having it is pretty immense. And shame also is about my yearnings not being met and not being validated in the world. So I have a model here. We'll just briefly go through this. So I think people have yearnings in the world. And there are three yearnings. We have a yearning for physiological integrity. I want a body that is safe and able and attractive and healthy and full of well-being. I have a yearning for interpersonal integrity, for people to be nice to me and kind to me. I want to feel like I matter to people. I want people to be interested in me, and I want to feel safe with people. And psychologically, I have a big yearning to think benevolently about me and about the world. So I want to think well of myself, and when I'm okay, I like who I am in the world, and that the world is an okay place, that I have sufficient faith in myself and in the world. And if my yearnings for integrity have largely been met, we will expect to meet a person who's well-rounded and balanced and feels good about themselves and have a sense of optimism in the world. But so often in the world, and specifically we're talking about people who are living with a stoma, their yearnings for integrity are compromised. So if we go back to those three yearnings, certainly with the stoma, the physiological yearning for body integrity is deeply compromised. I have this, I probably have some medical trauma from different procedures, surgery and stuff, but also this living with this bag that I don't want to have this, and all the implications around it, and how my body feels to have maybe let me down, or I hate my body, or I have a lot of shame around that. Then the interpersonal integrity may well get compromised because of it, because of course living with a stoma is an interpersonal experience. It's not just, as we'll see later on, it's just not a medical issue. So interpersonally, I'm thinking, how do I interact with people now, and maybe particularly intimately, and what will people think of me, and there's a sense of maybe feeling different around people now, and less of a sense of belonging. And then the third is psychological integrity, where when that is compromised, we tend to have a critical inner voice. I'm not good. I hate myself. I'm too fat. I'm too ugly. I'm not good enough at this. Everybody's better at me. And also we have a critical voice about the world that, I don't think I'll be well supported. I don't think those people like me. So when our yearnings for integrity are compromised, the outgrowth of that is shame. And shame is that experience of my needs not being met, my integrity yearnings are not being met anymore. And there's quite a collapse that can happen to that. And the result of this is what I call creative adjustment. So we creatively adjust at three levels: at the feeling, the thought, and behavior level. So the feeling level is, I feel sad, I feel angry, I feel down and depressed because I've got this stoma. And maybe thought level is, I hate myself, I hate my body, my life isn't worth living now. I don't know how I'm going to cope in the future. Nobody's going to like me. I'll never be able to be in a relationship. All those thoughts, probably quite negative. And then the behaviors is maybe I start to isolate. I withdraw from relationships. I become very preoccupied with different bits and pieces. So there's a whole cascade effect from the medical intervention of living with a stoma. And I suppose the definition of psychological trauma is to be living with the imprint of an overwhelming experience. So the medical, again, whatever is going on bodily with this person, that's the big trauma, and going through whatever surgical procedures. I'm not medically trained, so I'm not au fait with all of that, but that's quite a trauma. But there is a psychological trauma that also happens now. And it's not just the day that the person receives their stoma. It is, I have to live with this. I have to develop a relationship to this stoma, and I don't want it, and I don't want a relationship to it. So there is an imprint, and it will imprint it probably so many aspects, maybe every aspect of a person's life. And another definition of trauma is that life is never the same again. And I'm only guessing that you hear that as nurses, you hear that a lot, that my life will never be the same again, or has never been the same again, particularly maybe in the early days as well. So I suppose the dilemma for you as nurses is how do you can do all of the medical support, but how do you psychologically support the person? And you, as the stoma nurses, are the one person who has developed a relationship maybe with this patient over time. So you're perfectly poised there. So there's a part of the brain called the Broca's area. Again, I'm talking to people who know more about this stuff than I do, but the Broca's area is a language center in the brain, and it goes offline when people are actively being traumatized or when they're in the aftermath of a trauma. So as a psychotherapist, I would meet a lot of people whose Broca's area is just offline, and I'm guessing that is happening, especially with the newer patients who are recently finding themselves having to adjust to this. And what happens with the Broca's area is people do not have language for their experience. You know, if you say to someone, "Well, tell me how you're feeling about this," they're like, "I don't know. I don't know how to say this." So they will be very reticent about speaking. So what you need to do is to give people language for their experience. You know, you'll be waiting a long time talking to some guy about how he feels about the stoma. He's just not able. And it's not that he's resistant to talking. It's like he doesn't have the language. He is not able to articulate his experience. So that is a task that psychotherapists will have to do. And as a stoma nurse on the front line, I think it's something that you would have to do as well. And the first thing is to make your dialogue safe and non-exposing. So the message that you're giving them is, you don't have to say a word. I will not expose you. I'm not going to ask you how you're feeling. I know this sounds a bit counterintuitive, you know, we're going to have a conversation and yet you don't have to say anything. So that how's that going to work? But what you're doing is that you're putting the patient at ease, because I guess living with a stoma, there's an awful lot of very delicate issues that need to be negotiated, and they're things that we don't typically talk about. And unless you're very psychologically attuned, I'd say most patients will probably struggle at some level. And to let them know that you're not going to expose them is a pretty big gift, actually. So I'm going to take you through, I'll stop this share now and I'll just talk you through these slides around how to do this and how I would suggest facilitating this dialogue. So first of all is to make the dialogue developmentally appropriate. For example, if you are talking to a 53-year-old man or a 25-year-old woman, you need to pitch it at their level. So have an idea of that. And to begin, you know, by talking in a generic manner as well. I would platform this and say, you know, I would like to just touch base with you about what it's like to live with a stoma. Now, you don't have to say a word, but there are some things that I would like to say to you that might be of use to you. And already just in those few words, you probably alerted the person, and then they're now at ease going, oh, I don't have to say anything. She's just going to talk now. And then it's important to say, you know, I don't want to assume your experience, and I'm not sure what it's like for you. But again, that's very validating for a person that, you know, rather than, oh, this is just textbook and this is what happens, this is what you'll expect, which can be quite dismissive of a person who's saying, I don't want to assume your experience and I don't know what it's like for you, but I do know some things. So and rather than being the expert, I mean, you're stoma nurses, you are the experts, but people don't like the expert when we're talking on a very deeply personal level. So prefacing this with, in my experience, I've met, and let's say we're talking about the 55-year-old man. In my experience, I've met a lot of men your age who find this really stressful and challenging in three main areas. And what I'm suggesting you do now is you try to make this coherent for a person. And what I like to do as a psychotherapist is I like to support a person to organize their thoughts, because they often come to you very chaotic and all over the place, and there's so many thoughts and so many feelings, and there's a kind of a neat way to organize this. So in my experience, I've met a lot of men your age who find it stressful in three big areas, and people are very visual as well. Sometimes actually drawing these out or having these written down and showing them can where when people are traumatized and their Broca's areas offline and their cognitive, the cerebral cortex maybe not, online as much as you would like it, and they find it difficult to process linguistically and process all those concepts at a language level, but actually they're much more able to do it at a visual level. So I'm forever, you know, with clients on Zoom these days, I'm forever like drawing things out and writing stuff. And these are traumatized kids, and my words are over their heads, but what I'm writing is getting into them. So the three main areas are the personal, the social, and the sexual. And then because we've mentioned the word sexual, we'll just go straight in and say, so we don't have to talk about all of those at all. You don't have to say a word just to remind people that they're not going to be exposed. And again, they're the categories that people will struggle with. The personal. So how I feel about my body, me, myself as a person now, and the changes that have to be made, and then we're going to go through them socially and then sexually and say, you don't have to talk sexually. Well, I'll come back to that one in a minute, but there are three aspects to each of those issues. Three aspects of life that tend to get impacted at these levels. And one is the feelings, one is the thoughts, and one is the behaviors, like the model that we talked about earlier on. So let's take the personal. And maybe you're going to meet this person for three different meetings, and you'll take maybe the personal in the first meeting, then the social in the second meeting, and maybe the sexual in the third meeting, and for the personal for the first one. So there's the feelings, the thoughts, and the behaviors. And again, lots of men your age, what I want to do is tell you about what they tend to think. And again, I don't want to assume your experience, but this is often what I hear, and just to see if it relates to you at all. So maybe, and again, you'll gather up your accumulated experience around what is the feeling level for, and again, I don't know this, you know this, living with a stoma as a 55-year-old guy, like, how does a person feel about themselves personally? I imagine, there's a sense of them, their masculinity being impacted, and maybe they feel like less of a man, and they feel disempowered, and they feel sad, they feel angry, they feel all sorts of different feelings around it, frustrated, hopeless, whatever. So you kind of come up with whatever those feelings are. And then the thoughts, so often the thoughts are very negative about, you'll hear the word never a lot. I'm never going to be able to do this again. I'm never going to be, I'm never. And to take the word never out of your vocabulary, I'm not able to do it now. I can adjust to future when the future comes, but just now, because never is such a negative word when it's used in that context. So, and all the time you're engaging them as well, what are your thoughts about your body? You don't have to say a word, but if you were like, and this, lots of men think of themselves that, I'm never, I can't look at myself in the mirror, and this, that, and the other. And then the third one is the behaviors. What are the behaviors that and again, this. So I maybe as a 55-year-old man, I find that I have to use the bathroom all the time, and I'm always connected to the bathroom. I'm always worried about this. I don't sleep well now at night. How is your behaviour impacted? Not just directly related to the stoma, but indirectly related to it. What are you doing differently that you didn't do before? So we work through the feelings, the thoughts, and the behaviours. And again, you're focusing this on a third party. You're talking generically about other people your age. And that's doing something. It's normalizing it for me, going, oh, so I'm not the only one. And other 55-year-old men have gone through this, and this is normal what's happening. Because if people are going through psychological trauma, they kind of think they're a bit crazy. And then once you've worked through that personal, then the social, how do you feel about yourself socially, and what are your thoughts about socially and behaviors, romantically and all of that. And then, if there's trust, the sexual piece, and again, maybe they don't want to talk about it, but in my experience with the sexual, this is what guys your age often feel like. They feel really affronted, and they don't want to be sexual. They're worried about what's going to happen, or meeting people and what they're going to be thought of and stuff. And hopefully in those kind of conversations, you're going to get the head nod and God, that's exactly what I think. And bit by bit, the person will hopefully get drawn into the dialogue. And actually what you're doing is you're bringing their Broca's area back online. So you're encouraging this patient into dialogue, and a couple of statements that are very useful is, when you're talking generically about people, and you're always reminding them, I don't want to assume your experience, go, does that make sense to you? Or does that strike a chord with you? So I'm not directly asking you to say something, but I'm indirectly saying, does that strike a chord with you? Which is very invitational. It means that you don't have to speak if you don't want to. And you're always respecting their relationship with the stoma, which may be highly traumatic, highly defended, or they may develop a little bit of freedom. And I suppose then when trust emerges and the person feels validated, because that conversation, that generic conversation about their personal, their social, their sexual, and at each of those levels, your feelings, thoughts, and behaviors, that is very validating for a person. You can literally see them, they're sitting back and they're quite closed, and you'll see them sitting up and nodding the head, and yeah, and their voice will warm up. Yeah, that happens to me as well. So that validation helps you to join the patient at the heart of their experience. And when you get to that, when you feel like they're joining you and you're joining them, there's a connection, they feel like they're being got by someone, then there's a big question that is timely to ask them. And this is getting into their very personal experience. And what would you say is the worst thing for you about living with a stoma? And then when they say whatever it is that they say, sit back and listen. Don't get into advice giving. Don't get into making them feel better. Just tell me more about that. That sounds awful. Oh, I can't imagine how terrible that is. Tell me more. That's heartbreaking to hear. Tell me a bit more. And allow them to give language to their experience, and not to, I know as a nurse, you soothe the cut, you put the healing balm and stuff. Actually, the person needs to have someone to bear witness to their pain, and then the healing starts. This is, I train therapists all the time, and I'm always saying your interventions are often premature. You got to let the pain out, and then you apply the healing balm. And towards the end, what you want to do towards the end of each dialogue is inject hope. Well, I don't know what the hope is, but how easy it is to, once you adjust to this, how how fluent your life becomes then, and how it becomes a part of who you are, and not in a shame way, that you move towards the empowerment. But it's important when you're injecting hope not to overlook the present situation and invalidate their pain and their shame. If someone is telling you how hard it is and you're trying to help them to be positive, a lot of the time people just think, she's not listening to me, she just doesn't get me. And they go, yeah, right, whatever. So it's important to strike a balance between hope and reality as well. And I suppose empowerment comes only after the encounter with and the processing of living with a stoma in the first place. Like if I don't ever address what it's like for me to live with a stoma, I will never get to the far side of it, and empowerment and regular living where I have full acceptance of it and I have that fluency in my life. And I suppose what you're doing with all of this is you're taking them through the grief process of the loss, and the grief is very much past, present, and future. The past of what life was like before this, and what I have lost. I have lost so much of my identity and my joy and relationships and intimacy and all of that. And as well as now in the present, I have to involve other components in my living, like tending to the stoma and attending medical appointments, and having to negotiate life with this, and maybe withdrawing from stuff. And then the loss and the grief around the future as well. Maybe if it's a temporary stoma, not so much, but people who are going to be living with these stomas for life, it's my future is completely changed. The identity I thought I would have in the future is not the identity that I'm going to have. And that can be very scary for people. And again, you can weave all of this into the generic conversation about other people without wanting to invalidate their experience. I don't want to assume your experience, but there's been a number of men, quite a few men, who've talked to me about feeling just so much sadness and grief at the thought of their future, that God, how am I going to do this, and it just feels so scary. Does that resonate with you? And at that stage, you should get some, oh yeah, God, it is really scary for me. This person wouldn't have been able to say that themselves. My God, I feel really scared about the future, because they're Broca's areas of life, because they don't have language for their experience. But what you're doing is you're giving them language in a very indirect way. And you will notice the shift from shame to empowerment. Shame is a very muted, defended stance. And you will hopefully find them joining you in the dialogue, and being able to eye contact you, being able to take ownership of living with a stoma. And that's where the real empowerment comes. But it doesn't come until a person meets it head on. So we're coming to the end of the presentation. Hopefully that's been useful for you. Some tips around how to directly converse with people. And I suppose the takeaway from this is to not have expectation that people will readily be able to talk to you. They are not just uncomfortable, they're probably psychologically traumatized by this, and they don't have language. So enjoy the rest of the conference, and thank you for the great work that you do. Have a good day.